All right, so when we look at our OECD rankings, how does Australia rank compared to the others? Well, we're equal first in healthcare equity, third overall for our healthcare performance, so that's looking at all aspects of healthcare. We have the equal fourth for life expectancy, and 85% of Australians perceive their health as good or higher compared to the OECD's average of like 69%. So that's really good data. What are the negatives? So we are 8th overall for overweight and obese populations, and we currently have a high smoking and vaping population, and that is increasing. So these are the things that we will be looking at addressing in the future. So what are some factors as to why we rank so well in the OECD? So universal systems in Australia, such as Medicare, PBS, NDIS, means that we have equity of access to healthcare across a broad range of aspects. We have lots of pervasive public health campaigns, so you can't sit down and watch TV or listen to the radio without hearing some sort of public health message, common ones: smoking, road safety, mental health, etc. And despite the cost of living crisis everyone's going through, overall compared to other OECD countries, we have a high socioeconomic status. So more Australians have disposable income which they can use for extra health benefits such as private health insurance, gym memberships, etc. So briefly, why do some other countries rank better or worse than Australia? So let's look at the better ones. There's more than this, but just for example, Japan, they have good cultural dietary habits, which leads to lower rates of obesity and therefore lower levels of disease, because we know a lot of the preventable diseases in Australia are related to being overweight and obese. They also have high social cohesion, so if there is a public health message out there, everyone in the community is more likely to get on board and also support each other. Switzerland is another one that has high national wealth. They also have mandatory private health, so everyone in Switzerland has to purchase private health, which reduces wait times for treatment significantly, therefore increasing the levels of health and decreasing the rates of disease. Countries that rank worse than us, so the US, no universal healthcare system. So if you need to go and see anyone, GP, dentist, physio, whatever, surgeon, you need to pay for that out of pocket. And the out-of-pocket expenses to go and see those people are extremely high. Their life expectancy, just as a side note, is 79 compared to our 84. So Mexico is another one. They just have lower living standards overall, so housing, sanitization, etc., which leads to greater levels of disease. So what are some lessons that Australian healthcare system can learn to benefit all of us? So the first one, a sugar tax. So the UK have implemented the SDIL, which is the soft drink industry levy. So basically soft drinks that are pre-packaged have an added tax, so it costs them more money to buy those. The Indigenous healthcare partnerships that are present in New Zealand with the cooperation between the healthcare system and the Maori people, and the digital e-health system, which is implemented by Estonia. And that was your too long didn't study version of the OECD comparison.